In 1932, in the small, quiet town of Tuskegee, Alabama, a government experiment began. It was supposed to bring hope to men who had nothing: free medical care, food, and the promise of a better life. At least that is what they were told. 600 men were recruited, most of them poor African-American sharecroppers. They were told they had bad blood, a local term for almost any illness. What they didn't know was that doctors were lying to them from the very beginning. Behind closed doors, the United States Public Health Service had a different goal. They wanted to observe what would happen if syphilis, a deadly disease, was left untreated. Not on animals, not in a lab, but on real people. The men were never told they had syphilis. They believed they were being cured. In reality, the doctors were simply watching the disease destroy them. When the study began, there was no cure for syphilis, but by the 1940s something changed. Penicillin became widely available. It could have saved their lives, yet the doctors deliberately chose not to use it. They told the men the treatments were working. They continued their study, taking blood samples, performing painful spinal taps, and pretending to care. They even staged fake medical exams to keep the men calm, while quietly noting every new symptom, every death, every sign of the disease spreading to wives and children. The experiment went on year after year, decade after decade. 40 years passed. The world changed. Wars began and ended. Medicine advanced, but in Tuskegee the same lie continued. By the 1960s, a few people inside the Public Health Service began to question what was happening. Some tried to speak up, but they were silenced, told to stay quiet for the good of the study. And then in 1972, one man decided he couldn't stay silent anymore. A whistleblower leaked hundreds of pages of internal documents to the press. When the story hit the news, the world stopped. Headlines screamed about men deliberately left to die, about wives infected without knowing about children, born with a disease their fathers were never told they had. The public reaction was instant and furious. The government tried to defend itself, but there was no defense for what it had done. By the time the experiment was finally shut down, dozens were dead and hundreds of lives had been permanently destroyed. In the years that followed, survivors spoke out. Their voices trembled with anger and grief. They had trusted the people in white coats, the people who said they wanted to help. What they didn't know to realize was that they had become part of one of the darkest experiments in American history. In 1997, decades after the truth came out, President Bill Clinton stood before the survivors and their families and offered a public apology. He said what the United States government did was shameful and I am sorry. But apologies couldn't bring back the dead. They couldn't heal the damage done by 40 years of deceit. The Tuskegee Syphilis Study became more than just a scandal. It became a symbol of what happens when power and prejudice combine under the mask of science. Even today, its shadow lingers. It changed how Americans view medical research. It changed how Black Americans view the healthcare system. And it left behind a question that still haunts medicine to this day. When science crosses the line, who is left to stop it?